One wrong step in ABG interpretation can mean the difference between saving a life or losing it. So let's learn it how to do it perfectly. So before moving to ABG interpretation, why we need arterial blood gas? First of all, it helps us to assess the acid-base balance. It will help us to detect acidosis or alkalosis, whether in body we have too much acid or too much base. It also tells whether the cause is respiratory, is it related to lungs or metabolic kidney. Okay, and that's how it can help us to monitor condition like DKA, sepsis, renal failure, diarrhea, vomiting, COPD, and asthma. Alrighty. Next, it also helps us to evaluate the ventilation, carbon dioxide status inside the body. So partial pressure of carbon dioxide will show us how well the lungs are ventilating, and it is very useful in especially respiratory failure, COPD, neuromuscular disease, drug overdose, mechanical ventilation adjustment. The next step, third, it will help us to check the oxygenation. Okay, PaO₂ and HCO₃ indicate how well oxygen is moving from the lungs to the blood. Okay, it helps us to find out hypoxemia, ARDS, pneumonia, COVID, pulmonary embolism. And number 4, it helps us to guide the treatment. It helps us to determine if a patient need oxygen, ventilator changes, bicarbonate, fluids, insulin, especially for DKA, and bronchodilator extra. It also helps to prevent giving the wrong treatment. For example, for a COPD patient with chronic CO2 retention, we might not need the oxygen, but only the ventilator support. That's what we can do with ABG interpretation. And last thing, monitor response. So after providing all the intervention to various disease like ventilator adjustment, fluid resuscitation or medication, ABG confirm if the patient is improving or not. Okay, so let's move to the normal range of arterial blood gas. So pH is 7.35 to 7.45, PaCO₂ is 35 to 45 mm of Hg, HCO₃ is 22 to 26 MEq per liter, and PaO₂ is 80 to 100 mm of Hg. Let's move to ABG interpretation now. So always the first step is check the pH level. Okay, so the normal pH level is 7.35 and then 7.35 to 7.45. So during when we want to check the pH, always in the example make a line and then put like this 7.35 on this end and 7.45 on this end. Okay, if the volume is less than 7.35, it is acidic. Okay, and if it is more than 7.45, it is alkalosis. Okay, so this is always the first step. Next we will move to the second step. So after checking the pH, then look at the PCO2 and ask whether it's on the same side or opposite. Okay, so we will do like this. We will put on line. Okay, so 35 and 45. Okay, so now we need to check whether it is lining same side of pH or opposite pH, because according to the Rome, respiration is always opposite and metabolic is always equal. Okay, so if you will have same kind of pH, like something is pH is 7.28, that is acidic. Okay, and then patient is coming with PCA 258, that means they are going into the opposite direction. Okay, they are going into the opposite direction. That will be respiratory acidosis. Okay, if it is going into the same way, then just leave it here and then we will move to the next step, and that is the then look at a bicarbonate. Okay, so same thing we are gonna do here. We're gonna put a line. Okay, when we do the example, you guys will understand it nicely. So 22 to 26, we are gonna do that. Okay, if we didn't find whether acidosis or alkalosis is respiratory or not, then we need to check here. And according to the Rome, respiration is opposite, but metabolic will be equal. Okay, metabolic equal. So that's why we will have a pH here. So if pH values 7.28 and then metabolic component value like 19, HCO3 19 is falling on same side of the arrow, then it will be metabolic acidosis. If someone is coming with pH of 7.40 and HCO3 is coming with 32, they are falling on the same side of alkalosis. Okay, so pH is alkaline, and then because metabolic is on same side. Okay, let's move to next step, where we need to find out whether patient is having compensation or not. Okay, so in this one, the full compensation is if pH is normal. Okay, so if pH is normal, then it is fully compensated, but PaCO₂ and HCO3 both need to be abnormal. So only pH component is normal, but other both are abnormal. Then we will move to the partial compensation. Okay, so in partial compensation, all three values, pH, PaCO₂ and HCO3 need to be abnormal. So nothing is in the range. Okay, so that means body is still trying to compensate. In uncompensated value, pH is abnormal, but only one of the other value will be abnormal. It can be either pH plus PaCO₂, it can be pH or plus HCO3. Okay, so that is how the compensation works. We can move to the next example and let's do it together. Okay, so here is the example where patient have pH of 7.30, PaCO₂ 50 and HCO3 24. So always first step is check the pH. So we are gonna make a arrow here, and then we are gonna put our normal values 7.35 and 7.45. so that's our pH normal value. So patient is coming with 7.30. Okay, so that is 7.30 here, that is acidic. Okay, less than 7.35 acidic. Then we will move to the second step, check for PaCO₂. Okay, again we will put the same line and we will put the normal values 35 to 45. Okay, 35 to 45, and that is our PaCO₂. And then what we will find, the patient is coming with 50. Okay, so that is falling on here. Okay, outside more than 45, and then we can still go for HCO3, but because on the first two step we are already find out that patient is acidic from 7.30, and because PaCO₂ is going on the opposite side, it is respiratory acidosis. Okay, and if we will check the third value, that is our HCO3, if we will check that one, that will give us whether it is compensated or not compensated. Okay, so check for HCO3. So 22 to 26 is normal HCO3, and then the patient is coming with 24. Okay, so that is falling somewhere in the middle. Okay, it will be the center. Okay, so that is in the normal. So what we have learned with the uncompensated, if pH is abnormal here, but only one other component is abnormal. Okay, that is only respiratory component. That's why it is uncompensated respiratory acidosis. Okay, let's move to another example. So then we have a example of patient whose pH is 7.50. Okay, we are gonna do same way, normal values. So this is our pH, 7.35 to 7.45, and patient is coming with 7.50. So that is going more toward alkaline side. Next step, we are gonna check for PaCO₂, and our normal range is 35 to 45, and patient is coming with 30. Okay, so that is here. And now from this one we already found out, like patient is alkaline. Okay, and because it is opposite to the respiratory opposite, it is respiratory alkalosis. Okay, but we still need to find whether it's compensated or not compensated. So we will put another line for HCO₃. Okay, so HCO₃, and HCO₃ normal is 22 to 26, and patient is coming with 24 again. Okay, so that is falling in the middle. So again, like last example, it is uncompensated respiratory alkalosis. Okay, so that's easy one. Let's move to next one. So in this one again we are gonna do same thing. We are gonna make 3 lines. So first one is for pH, and always put normal values, 7.35 to 7.45, and patient is coming with 7.28. So that is alkaline because it's less than 7.35. Next, second step, we will check PaCO₂. In PaCO₂, normal level is 35 to 45. So now patient is coming with 35. Okay, so that is within the normal range. So we didn't find out whether it's respiratory acidosis yet or not. Okay, so then we will move to next step, HCO₃. Okay, where normal level is 22 to 26, but patient is coming with 18. So what we have learned in the past, that if in the room respiratory is opposite but metabolic is equal. So now acidic value 7.28 and 18 is going on the same side, it's not on the opposite side. So this one is metabolic acidosis. Okay, uncompensated metabolic acidosis. Okay, next one, let's do our last example. So in this patient we have ABG value of pH is 7.42. so we will make a line. So again we will do 7.35 to 7.45 is our normal, but here patient is coming with pH of 7.42, that is going here 7.42. So if we will see 7.40 here, it is more inclined toward the alkaline. Okay, so this will be alkaline patient. Okay, we will move to the next step where we will check the PaCO₂. So we'll make again line PaCO₂, and then we will put the normal range 35 to 45. Okay, so patient is coming here with 48. Okay, so because it's going towards same side, so we haven't find out yet whether it's respiratory or not. So we need to move to the third step, okay, that is HCO₃, where normal range is 22 to 26, okay, and now we need to find out is 28, okay. So this is more toward the alkaline side, okay, alkaline side of pH. So what we have learned with Rome: respiratory opposite, metabolic equal, okay. So now because 7.42 is falling on the same side as 28, okay, so this is metabolic alkalosis, okay. But in this scenario, because 48 PaCO₂ is also out of the range, so this one is fully compensated because pH is normal and all other value PaCO₂ and SCO₃ is abnormal, out of range. So it will be fully compensated metabolic alkalosis. That's it. Thank you for watching this video. Please do subscribe this channel and share with your friends.